Over 15,000 people engaged with my video on all mental disorders explained in 15 minutes. And I've read all your concerns. I know that many of you may not have access to therapy, but I have a solution for you. You can take control of your mental health with none other than the cognitive behavioral therapy, also known as CBT. Cognitive behavioral therapy is a type of talk therapy that helps individuals manage problems by changing their thought patterns and behaviors, often used to treat anxiety, depression, phobias, and other mental health conditions. CBT was first developed in the 1960s by psychiatrist Aaron Beck, who is considered the father of cognitive therapy. Aaron Beck, while working with depressed patients, noticed the presence of negative automatic thoughts and developed cognitive therapy as a way to address these thoughts. So, how does CBT work? Imagine your brain is like a messy closet. CBT helps you reorganize your thoughts and throw out the ones that don't serve you. This is done by breaking the vicious cycle. In CBT, a vicious cycle refers to self-perpetuating loops of thoughts, feelings, and behaviors that maintain psychological problems, often fueled by negative automatic thoughts. Understanding and breaking these cycles is a key part of CBT therapy. The vicious cycle in CBT highlights how negative thoughts lead to specific feelings, which in turn trigger certain behaviors, reinforcing the initial negative thoughts and perpetuating the cycle. Example, someone with social anxiety might think, I'm going to embarrass myself, leading to feelings of anxiety and fear, which then causes them to avoid social situations. This avoidance reinforces the belief that they can't handle social situations, thus perpetuating the cycle. Now, if we reframe these negative thoughts using CBT, the new thought would be, people are probably focused on themselves, not me. You'll automatically feel less anxious and engage more calmly in social interactions. Just like that, your mind starts working for you instead of against you. Identifying and mapping out vicious cycles can also help simplify complex difficulties, illustrate how problems manifest, and pinpoint ways to intervene. Let's look at some of the most common examples of vicious cycles that manifest in different mental disorders. Anxiety. Anxious thoughts lead to avoidance, which reinforces fear, panic, and anxiety. Depression. Negative thoughts about oneself lead to feelings of sadness and low motivation, which can lead to social withdrawal and further negative thoughts. Low self-esteem. Negative core beliefs about oneself can lead to safety-seeking behaviors that, while providing short-term relief, ultimately reinforce negative beliefs. Here are some extra bonuses of using CBT. 1. CBT primarily focuses on current problems and challenges rather than dwelling on the past. 2. It is a collaborative process where the therapist and client work together to identify goals and strategies. 3. CBT teaches practical skills and techniques for managing difficult situations and challenging negative thoughts. 4. It is a goal-oriented therapy with the aim of helping individuals achieve specific, measurable outcomes. Let's get practical. Here are some mind rewiring techniques you can use right now. 1. Cognitive restructuring. Challenge your thoughts. Next time you have a negative thought, pause and ask yourself, is this 100% true or am I assuming the worst? Most of the time, we immerse ourselves in thoughts that have no logical or rational basis and are exaggerated. 2. Exposure therapy. Face your fears in steps. Fear controls you until you face it. CBT helps you expose yourself to small challenges until your brain realizes, hey, this isn't as bad as I thought. In fact, they say, fear builds walls where there are none, turning possibilities into obstacles and dreams into doubts. 3. Thought journaling. Track your mindset. Writing down your thoughts helps you recognize recurring negative patterns and triggers. Thought journaling also helps you clarify your emotions, encourages rational thinking, tracks progress, and facilitates problem solving. Now, what's the science behind CBT? Does it really work? Studies show CBT literally reshapes brain activity, especially in areas linked to anxiety and depression. In fact, research proves it's just as effective as medication for many mental health conditions. Prefrontal cortex. CBT often leads to increased activity or connectivity in the prefrontal cortex, which is involved in executive functions like thinking, decision-making, problem-solving, and emotional regulation. Amygdala. In some cases, CBT can reduce activity in the amygdala, a brain region involved in processing fear and anxiety. Changes have also been observed in other brain regions, including the anterior cingulate cortex, ACC, hippocampus, and limbic areas, depending on the specific disorder and treatment. Well, even with the science that backs it up, some myths about CBT still persist. Let's bust them. Myth number 1: CBT is just positive thinking. CBT doesn't teach you to ignore problems or force positivity. Instead, it helps you identify and challenge distorted thoughts, replacing them with more balanced and realistic perspectives. Myth number 2: CBT only works for mild issues. CBT is highly effective for a wide range of mental health conditions, including severe depression, anxiety disorders, PTSD, OCD, and even schizophrenia. It is widely recommended by professionals because of its evidence-based effectiveness. Myth number 3: CBT is a quick fix. While CBT can be structured and goal-oriented, progress depends on the individual. Some people see improvements in a few sessions, while others need more time to unlearn deeply ingrained thought patterns. Myth number 4: CBT ignores emotions and focuses only on logic. While CBT helps people challenge irrational thoughts, it also acknowledges emotions and helps individuals process them in a healthier way rather than suppressing or ignoring them. Myth number 5: if CBT doesn't work immediately, it won't work at all. Like any therapy, CBT takes time and practice. Some techniques may resonate more than others, and consistency is key. Progress isn't always linear, but long-term benefits are well documented. Conclusion: rewire your mind, rewire your life. Your mind is powerful, but it's also trainable. Before we wrap up, I wish I could dive into all the powerful techniques used in CBT, but there's just so much to cover. That's why I'm thinking of creating a full-fledged course on it. If that sounds interesting to you, let me know. I'd love to make it happen.